Hey there, Dave Cuff, HME Business, and I'm here talking to Mike Lorenz of Brightree. He is their Vice President of Resupply. Mike, how you doing?
Doing great, thank you.
Mike and I are regularly talking about Resupply these days. We just did a podcast interview, if I'm not mistaken.
Yeah, a couple months ago.
Yeah, there you go. So, okay, but this is an interesting topic, and it is the labor shortage and how that's impacting resupply. And, you know, I got to say, Mike, you know, I've talked about labor troubles for the industry from a variety of perspectives, like billing, customer service, and things like that. But it never dawned on me what a massive challenge it must be when it comes to resupply. Maybe you could kind of break it down for people out there watching this video. You know, how are the industry's labor shortage woes impacting resupply?
So it's a big deal. You know, a bunch of the folks watching this obviously will know this from personal experience. But we're seeing the labor shortage really ripple through this industry over about the last 6 quarters.
Yeah.
From early in 2021 all the way through to today. So in resupply, it affects the business in a couple of ways. Obviously, not having enough folks slows down your pace of outreach.
Yeah.
It slows down the pace of getting products out the door when you do make contact with your patients. And downstream, it really hurts the retention of your patients, and it really hurts your patients' adherence to therapy. So, you know, that lack of enough people to call patients, to answer the phone when patients call, to process orders when patients want their supplies, has really hurt the industry. We've seen it in the numbers across the board over the last 12 months. We kind of monitor this pretty closely. So we've been working pretty aggressively over the course of 2022 to really address this problem with our services.
Gotcha. And it's got to be maddening, because we're talking about, you know, recruiting, training, retaining people to do like a really complex set of tasks. There's a lot involved. You know, resupply isn't a one-shot thing; it's an ongoing process.
For sure. So, you know, what we try to do is exactly break that problem, right? We try and tackle complexity in a couple different ways, and we try and break it down so it is simpler, so we can make the processes simpler for the folks that we bring on board to do this, especially in our live call services operation. But then we throw a lot of horsepower at the tools that our people use to make this process simpler. So, you know, one of the things that we've had to do over the last 12 months is really, once we saw that this labor shortage was going to persist, you know, the first quarter or so you thought, oh, there's a lull in the labor market. 3-4 quarters later, you know, hey, this is an ongoing issue. So what we did is we retooled how we recruit across the industry. So we used to have a couple of geographical pockets where we try to keep employees. Now we recruit nationally. We changed the filters for what types of employees we look at. Obviously, you know, one of the challenges in this industry with labor right now is the costs have gone up. So we've had to change the cost profile of the employees that we look at. So we've invested a lot more in the training. Once we do recruit these people and bring them on board, we train the heck out of them. So once they hit the phones for our customers, they're a lot more efficient, and we can keep them longer. So that investment pays off, but we really had to rethink the whole process of bringing employees on, soup to nuts.
And let's dive into that. You know, what are kind of the key resupply solutions that you guys are providing to help providers contend with this? You mentioned live call. Maybe you can kind of break it down for folks out in the audience.
Sure, no problem. Obviously, what we try to do is automate things whenever we can. So our software platforms are fantastic for that. You know, Connect and Snap, you know, both great software platforms at automating processes that are needed in resupply, but you're always going to need the human element. And so live call is the biggest piece that we've seen providers struggle with in resupply, where, hey, you've got to call these patients. Right now we're up to, call it 40-50% of patients ordering via text and email. That still leaves half of your patients that need a phone call.
Yeah.
So that's a big deal.
That's not a small amount. Even 10% is not a small amount.
50% is a big deal.
Yeah.
And so what we've done is really tried to marry technology with people.
Okay.
Because as we saw this ripple through the industry, we saw customers coming back to us that had done their own call centers and were doing a decent job, but they could no longer handle it at a local level.
Yeah.
Because it's all of a sudden, okay, there just aren't enough people in, pick your city, Cleveland, Columbus, you know, Toledo, wherever.
Yeah.
That, hey, you know, I need people to call my patients, and I can't find enough of them locally. So our national platform allows us to kind of recruit nationwide. We've got a deep management team. We've got about 10 folks that are helping manage this call center operation, but we've thrown in a lot of tools. So we've invested in technology. We figured, hey, we actually need to up our game to do this well for our customers, especially when you've got a nationwide working from home kind of workforce. So we've got kind of three legs that we've looked at. One, we've got kind of workforce management technology, where it just helps track. We've got over 150 agents right now on payroll. It helps track what they're doing all day, every day, where they're assigned, their hours, et cetera. So we can make sure all of our customers have coverage across all the time zones they're working, from start to finish, how many employees are on the phone for those customers. It's a pretty complex tool, but when you're big enough, you can invest in that technology. You can invest in the people that run that technology to make sure that workforce is always there for your customers. Secondly, we've got kind of a monitoring angle that we look at for the employees themselves, where we're investing in AI technology to kind of monitor all the phone calls. And so it's looking for changes in tone of voice of like, hey, is this a rough phone call? Is the patient having an issue? Is the agent having an issue? So somebody can intervene really quickly and say, okay, hey, let's go listen to that phone call, see what happened, coach the agent, reach back out to the patient if there's a problem that didn't get solved. The AI will listen to key words. Hey, are we not saying the right things to these patients? This customer really wants to emphasize X. Are we saying X on the phone when we're talking to their patients? So that AI technology is great. But
That's fascinating. I had no idea this existed.
Yeah, it's hard to do at a small scale, but luckily we're big enough where we can really invest in the technology and the people to use that technology. And then third, a lot of analytics. So it's great having those first two pieces. Where are all your people and what are they doing? Hey, listening live and making sure that those conversations and interactions are fantastic. But then the third piece is, hey, just monitoring. Hey, are we reaching all the patients? How often are we reaching out when we can't contact them? What happens on all those interactions? So those three legs of technology, we've really doubled down on the investment this year, and we've seen it pay huge dividends over the last couple of quarters.
There you go. Dave Cuff, HME Business. I'm talking to Mike Lorenz. He's the Vice President of Resupply for Brightree. We're talking about the labor shortage and how it's impacting resupply and some of the smart solutions that companies like Brightree are coming up with. We've been talking about live call and some other items. Getting back to the topic, are the solutions that you're making for any specific type of resupply, like is it sleep only, or are you looking at other disease states as well?
That's a great question, Dave. So obviously we have a huge sleep population on service, but we also have other disease states. We have a large population of patients doing incontinence, urology, and diabetes. And so those are three where we've really seen a lot of need in the market, and we're meeting that. But kind of across all the disease states that Connect offers, which there's 8 different disease states, we can do live call on top of any of those. For patients, for customers that have enough patients where this makes sense for them.
Gotcha. Okay, and then is this? I think I know the answer to this, but is this inbound or outbound, or is it both? When it comes to your actual agents.
So, great question, and actually, it's really overlooked by a lot of people. Unless you've been in this industry and had to manage staff and try and manage the customer service aspect, inbound is incredibly important. Inbound calls. I remember I used to run a DME provider, and it would frustrate the heck out of me when I have patients contact us and say, hey, I tried to call and no one answered. So our service does both inbound and outbound. And it's critical for 2 reasons. One, inbound's a huge need that our customers have, and we want to solve it. 2 is our outbound service. Anyone that's run an outbound call center, 75% of the time that you dial the phone, you're going to get a voicemail.
Yeah.
So you're leaving a voicemail, hey, this is Mike at ABC Medical, wanted to talk to you, please call us back. So those turn into inbound calls.
Right? I didn't even think about that.
We drive a ton of inbound volume, so we need to answer the phone. We're the ones that called them, so we need to answer the phone.
It's like a self-fulfilling prophecy.
100%. So, and half of those inbound calls turn into orders. So those are great calls we're driving the activity right back to us to answer the phone. Here's why we called you. You're due for your supplies. Make sure your insurance is correct. Make sure you need all this stuff. Get it out to you promptly. So inbound and outbound is critical. People think of outbound as, hey, you're calling the patients to get the orders. Answering the phone to get the orders is frankly half of the battle.
Gotcha. So let's think about this from the provider point of view. Obviously, they're going to want to maintain branding. How do they do this working with your live call service?
No, it's critically important. No one wants kind of disjointed patient experience. So when we dial out and when we answer the phone, we do it with the provider's name. We've got teams that are fairly dedicated to the accounts that they work on. So all day long they're making outbound calls for ABC Medical or 123 Medical. When they answer the phone, same thing. So it's a seamless experience for the patients. We see ourselves as an extension of the provider, and we're just able to ramp up and ramp down the amount of staff that goes against those accounts just because of our scale.
That was going to be my next question, is in terms of scalability. So if a provider either all of a sudden has some success or maybe brings on a new line, this is something that you guys can respond to.
Huge. Bringing on a new line, having some success. Another thing we see is acquisitions. There's a lot of this happening in the industry. Some are huge headline acquisitions. A lot of them are just small mergers between companies that are in a local area. But if we get 4 to 6 weeks notice that, hey, these two companies are going to combine, one of them is already on our service, they want to add, they want to double the number of patients they're getting served, we can hire up, we can train those employees, we can get them on the phone, they'll be ready to go, when that transaction is closed or when that new product line comes along. So it's really valuable. And when you think about some of the hidden values of this service, why do people outsource? Hey, it's hard to find and keep people. It's also hard to say, okay, I'm going to just go in 6 weeks, go find and recruit and train and onboard 10 new employees.
Right.
And so we can do that. We do it every month. We've got a class of folks coming through that are being trained and recruited. So that's a huge value that I think we bring to the providers.
Well, and like you said, your hiring footprint is basically national. And this is something that I'm hearing from a lot of outsourcing companies, or I don't even know if outsourcing is the right word, because it's more like you're providing services to HME providers. It's more like you're service providers, because a smaller provider, they don't have that kind of hiring footprint. They don't have that kind of HR muscle, recruiting muscle. And then even if they did, to retain them, it seems like it just makes a lot more sense to kind of consolidate that effort, so to speak.
Yeah, and what we're seeing, everything you said there is exactly right. What we're seeing is a lot of providers are saying, hey, I only have so much recruiting and retention muscle. Where do I apply that strength?
Yeah.
And what they're doing is they're applying it in roles that are necessarily local.
Yeah.
So, hey, I need a driver to drop stuff off at people's house. I need someone to work in this branch to greet people when they come in and do setups of their equipment, etc. They're focusing their resources on finding and retaining those folks that need to be local. And they're outsourcing that piece where, hey, this can be anywhere. It's got to be a great experience. We don't want, foreign accents, all that stuff that we hear out in the market. Hey, all of our folks are domestic, but they don't have to be sitting in the same zip code as the patient to provide a great service.
So another question to change gears. Does a provider have to be a Brightree customer? Do they have to have Brightree installed at their location in order to use your services?
Great question. Really what we think about is what software platform are we calling on? And so Brightree has 2 resupply platforms. One is Connect. And if you're a Connect customer, you're a Brightree customer. It's kind of tied in directly with Brightree. Snap is integrated with Brightree, but it's separate. So
Gotcha.
If you're a Snap customer, you have any other billing system. Live Call will go right on top of Snap, call your patients. You don't have to be on Brightree billing. Snap is a Brightree property, and it integrates great in the Brightree ecosystem, but it integrates external too. So for sleep, you can use any billing system.
Gotcha. And then in terms of implementation, whether it's a Brightree, whether they're using Brightree Connect or they're using Snap, how does a provider who's interested in these services go about integrating them into their resupply operations?
It's actually pretty easy. The part that's more difficult is, hey, let's get the software platform set up, make sure they're functioning well for your business. The resupply calling goes right on top of those. It's pretty easy for us. It's just, hey, let's make sure we've got all the details about how do you like to interact with your patients. Are there any peculiarities with how you answer the phone, how you outreach, maybe certain policies when we're executing sales orders. But it's pretty cut and dried in a 6-week process.
Gotcha. Okay, and if people are here at the show and they want to find out more about Live Call and these other services, where do they find you guys?
Great question. I love that question. So we're booth 1125 here at Medtrade.
Yep.
Booth. You can see it right when you walk in.
I was going to say we're right by registration, right?
Exactly. It's colorful
Yeah.
And bright. But if you're not here at Medtrade or you're seeing this after you attended, Brightree.com/resupply, you can get all kinds of information.
Okay, easy enough. Mike, thanks very much for the time and the information.
No problem. Thanks, David.
All right.